Hi, my name is Michaela Mendez and I'm a nursing student from HAC. Can you please verify your name and date of birth?
Isao Mendez, September 4th, 1995.
And do you have any known allergies?
No.
I'm going to wash my hands, close the curtain to provide privacy, and today we're going to be giving you oxygen. So I'm going to make sure that my patient is in high Fowler's position, and then I can go ahead and check to see if my patient has lack of oxygen, and some ways to check are to see if there's any clubbing on the nails, or to see if there's any cyanosis in the back, the mucous membrane. And then I can go ahead and take my, I would have a pulse ox, and I can go ahead and place that on the patient's finger. A normal reading is between 95 to 100%. This patient is going to be lower than that percentage, so they are in need of oxygen. So I can go ahead and we're going to start off by demonstrating the nasal cannula. So this would be the most appropriate oxygen device to use for this patient. So first I would start off by plugging it up to the oxygen tank, and then I'm going to go ahead and set it to 1 to 6 liters a minute, which is 24 to 40 FiO2. And then I can go ahead and check to make sure that the oxygen is coming out properly by placing the prongs close to my wrist, just to make sure that I feel the oxygen coming out. And the oxygen is coming out, so I can go ahead and place the prongs with the way that the nasal canal goes into the patient. So then I can go ahead and place the nasal cannula around the patient's ears, and then I would go ahead and tighten it, just tight enough that it keeps it on the patient, but not tight enough that it's going to pinch the patient's skin. So the next thing I would do is, once I got a pulse ox reading, this patient is in need of a simple face mask. So this would be the most appropriate oxygen device to use for this patient. So first I would start off by taking it out of the package, and I put it together. If it's not already put together, I would go ahead and connect it to the oxygen device, and then I am going to go ahead and place it on the patient. This one would actually go around the patient's head rather than the ears. So there would be a string that I would put around the patient's head, and then I can go ahead and tighten it. And then I would start by putting it on from the nose and working my way downward. And then once it's tight enough, I can go ahead and just check all around to make sure that it's sealed correctly around the face and that everything looks good. So now once we get another pulse ox reading, this patient is in need of a non-breather mask. This would be the most appropriate device used for this patient. So first off, we would start by attaching it, unpackaging it, attaching it if it's not already attached, and then plugging it up to the oxygen tank. And then I can go ahead and I would check the flaps. There's 3 flaps on this one. So I'm going to place the glove on, and I would go ahead and put my finger over top of the flap and just make sure that the bag is inflating. The bag should always be inflated. If the bag is not inflating, this can decrease the amount of oxygen the patient is getting, and that can actually harm the patient rather than help them. So this one has oxygen flowing through. This one is, the simple face mask is supposed to be from, I would make sure that one would be set. So that one would be set from 6 to 8 liters per minute, and that one would be between 40 to 60 FiO2. This one is going to be set at 15 liters per minute, and that is 80 to 95% FiO2. So once it's set and the bag's inflated, I can go ahead and place this on my patient. This one is another one that goes over the head. So it would be placed over the patient's head, and then I would make sure that it's tight. I would start from the nose and work my way down with putting it on, and then once it's secure on the back of the patient's head, I can go back to the front and just make sure that it is secure the whole way around. And I would want to make sure when they're exhaling that both flaps are working properly on either side as well. So now we're going to go ahead and use the incentive spirometry. This is used for post-operational patients or patients that have respiratory problems. So it's to help strengthen their lungs. First, I would go ahead, and it would be based off of height, their gender, their height, and their age. So then once it's properly set, I would show the patient how to use it. I would also make sure that my patient is still in high Fowler's position. So I would have the patient hold it on either side, and then they would go ahead and you can take a normal exhale normally. And then once my patient does that, they're going to place their lips around the mouthpiece, and I would just make sure that it's sealed correctly around their mouth. And they're going to take a nice, slow, deep breath, exhaling for 2 to 6 seconds. And then once they're done, they can go ahead and take a regular breath. And then they can go ahead, and you should encourage your patient to cough afterwards. So then I can go ahead and make sure that my patient is in a safe position. I can give them their call bell. I can go ahead and wash my hands, and I think that's it.